and we're here on the Huddle this morning to talk a little bit about our upcoming symposium. It's our 13th symposium that we are going to be having next week, February 23rd through the 27th. We're super excited about our lineup of speakers, and I'm lucky enough to have a couple of them with us here today. Um, my name again is Margaret Downs, and I am just your podcast host. Here we are this morning. We have Leslie Bonsi, and Leslie's been out in the sports nutrition world for many years. We're super excited that she's been able to join us this morning and talk a little bit about her topic and what she's going to be presenting. And then we have Kelly Patterson, who's also just a distinguished dietitian. We're excited to have both of them here to give us a little bit of a sneak peek at what they are going to be sharing with us next week. So I'm really excited to have this time with them and give them a little bit of time to talk with our listeners and our followers to create some interest in showing up next week because we can't wait to see them in person. And Leslie is going to be presenting on a really interesting topic, communication with conviction, words to be heard. She will be presenting on Tuesday, February 24th at 1:30. And Kelly is also presenting just a very important topic on omega 3s and eating disorders. And this will be Monday, the 23rd at 1:30 p.m. So super excited about both of these topics. And so, if we could just for a minute, I just want to take just a few minutes and introduce you both, let you tell us a little bit about where you're currently working, how you're working in the field, and a little bit just about yourself so our listeners can get to know you a little better. So, Leslie, we'll start with you.
Sure. Well, hi, Kelly, Margaret. It's great to be sharing the screen this morning. So I like the fossil fuel. I've been around for a very long time, and so have done a lot of different things within this profession. As a registered dietitian, first and foremost, as evidence based, because I think that's really important, as being able to get information out there that's also combating the misinformation that unfortunately is too pervasive. So, I've always had clinical at my heart, even working in the sports nutrition space, because let's face it, there are athletes that have underlying issues that need to be dealt with nutritionally, and we are the ones best equipped to do that. So I have spent time in the collegiate space, the high school space, the Olympic space, the professional football space for way too many years. And so now transitioning, hey, let's be real, is transitioning away from the surreal to the real, is working with real people where I think it's truly our bread and butter for all of us. And those are also the individuals that are most confused by the cluster of what it is that they're seeing out there. And so, I really am a very big believer in how do we sort through all of that and give people a plan of action that they actually can follow, free of nonsense. I also spent several years as a spokesperson for the American Dietetic, or now Academy of Nutrition and Dietetics, which I keep dating myself to when it is that I was. But because of
I'm
that,
with you. I'm with you there.
right? And so I do think that the communication piece of it is really critical, is not just that the science, but also reading the room. Who are we talking to? And are we resonating with relevance with those individuals? Because if we're saying by a high price something to somebody who is on a fixed income, that doesn't really work well. So I'm going to be getting into a lot of nitty gritty about that. So a lot of educational platforms that I work on, that I write for, working on a book right now with my partner that's a host on our bucket list, kind of. So trying to get it done, but busy, 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 getting ready to take the CSSD exam for the very last time because I am not doing this again. Just so.
Oh, really? Wow, wow. I got to take mine too this spring,
Oh my
dreading it.
gosh.
Yay, that's always a ball of fun. But I can't believe you're not just going to keep going. No, no, you can't leave. You
Oh,
can't. You
no.
can't give up those
I'm not
credits.
leaving. It's just that, I think at this
The
point
test.
I should be grandmothered in because I am one. I think that's very,
Yeah,
very fair
yeah.
criteria, right? After 4 times of taking it, I think I've proven myself in this profession. It's like, we don't
Yes,
need to
good
take that
point.
exam anymore.
Good point. Good point. The science is always changing, though. I'm always amazed at how fast and quickly things are changing in our field. And now we have this whole, surge of gut health stuff happening. So it's going to be interesting to see where the next 10 years takes us in scientific
Yeah,
advancement.
I think we're having a lot of gut health conversation, which is great, but the substantiation behind that is a little iffy at this
Right.
point, and that's really why it's job security for us.
Yeah.
Is
Right.
right? It's like,
Yeah.
okay, detour. Okay.
Amen.
So it's like, yeah, yeah.
Yeah, yeah. Well, thank you so much for that. I mean, I know you've been out in our field for a long time and mentored many dietitians coming along, and I think that communication piece cannot be underserved. That is just something I'm so excited to hear you talk about, especially after having worked with so many different types of athletes and people in the field. So, super exciting. All right, Kelly, well, tell us a little bit about you, what you do with Omega Quant, and a little bit about your topic and what you're going to be talking about.
Yeah, thanks for having me, Leslie. I'm like inspired after hearing just you talk for just a few minutes. Yeah, I mean,
Yeah.
like the misinformation and all that, like, gosh, it's couldn't be more like prescient right now. It's so like I can't wait to listen to your talk.
Yeah.
And yeah, people are finally talking about fiber, which like of all the gut health, I'm
Yeah.
like, yay, fiber's
Finally.
finally getting some attention. That's a good thing.
Right.
Yeah.
So many
But
benefits to that fiber
yes,
stuff.
finally. Yeah, so I currently work for Omega Quant Analytics. We are a clinical laboratory, and our specialty is measuring fatty acids in the red blood cell. So that's what we do. My role as a clinical nutrition educator is kind of what it sounds like. My job is to educate clinicians and customers on the importance of omega-3s, kind of ways we can get more omega-3s, on our also educating on the tests we offer. I also That's kind of my commercial role. I also help on the research side of our business, so we do a lot of analytics for research, and we also coordinate and run research studies as well too. So I do some of the research coordination on that side. So my role is kind of two sided there. But my background is I spent a long time in tactical. So I worked for the military for a long time. And worked in my last position within the military. I've been with Omega Quant now for 4.5 years. And my last position within the military, I spent about 5 years as a tactical dietitian for a special forces unit at Fort Bragg. So that was my background and how I kind of got to where I am. We used Omega Quant tests, and so that's how I
Okay.
ended up at Omega Quant. And
Nice.
then my topic I'm going to talk about for the symposium is omega-3s and eating disorders. Kind of one of the areas that is really kind of exploding right now, kind of just generally, but also within the omega-3 space is mental health. We're looking a lot at what role omega-3s can play in the treatment of mental health conditions, possibly prevention of mental health conditions. So we'll go through and look at the evidence, where omega-3s might be useful, and what the research says right now, as of right now.
Well, that is just super exciting and also so relevant, as this points back to Leslie's earlier comment that we know athletes are definitely in need of the health
Yes.
compartment of what they're doing. It's such a kind of misrepresentation to say that athletes are like these pictures of health when we know they have so many things that they're dealing with, performance based mindset. So
Yes.
eating disorders being one of those things that we have all encountered throughout our practice with this group of people. So
Yep.
learning about that is going to be so important and so exciting, and just love the preventative focus on that long term, and longevity, especially with mental health and sport. So all right. Well, I can't wait to dive in just a little bit. We're just going to give you a sneak peek because we don't want to talk about everything and just create a little bit of excitement around this, because the Sports Nutrition Symposium have been going on for years and we have really had some great speakers. And so just love that we've been able to kind of get in front of people before that, let them know what to expect. You can register at mysportsd.com. So please, come on in and join us. The symposium is free, and you can then sign up for VIP which are your continuing education credits if you want to. And those continuing ed credits are good for and available for a good period of time. So, no excuses not to jump in and listen to these amazing lineups of speakers that we have. And you can see all of them posted on mysportsd.com. So, Leslie, tell us a little bit about your topic and how you got here. And also, I mean, you're writing a book. Wow. Is this your first book that you're publishing?
No,
No.
no, I would
Okay.
not
I
how
didn't
much
think
fun
so.
and punishment is like in the this is this one is it is a performance nutrition text to be a complement to other texts that are used in the classroom, but it is for non-nutrition majors. So
Okay.
my colleague Roberta Anding and I are co-authoring this, and it's really taking a deep dive. This is beyond the grams, the macros, the percentages, whatever. Is really what's the mechanism behind this? Let's think about physiology, physique, performance, practicality, all of it. Let's consider athletes at different ends of budget spectrums. Let's be respectful of culture. All those things that kind of get lost in translation when they're just because we want to focus on the numbers, right? People don't eat macros; they eat food,
Right.
and all
Right.
that. So we're really looking forward to it. Maybe I'll say a labor of love question on the love, but yeah, it is. We are getting to it. So yeah, so very excited about doing that. And
Great.
for this is all of us are communicators, right? This is what we all do. And certainly there's a lot of people in the nutrition space. I eat, therefore I'm an expert. Not true, but it is that way. And so I always talk about this as the registered dietitians are the winfluencers in the world of the sinfluencers that are out there, because it's very easy to click on something and get information, right? Whether it's about
Mm,
omega-3 or whatever it is. And so how we bring that message in terms of the way we communicate, if we are talking to a person one-on-one, if we are talking to a group, if we are doing something online where that group that's seeing the information is not immediately available to us, realizing that everybody doesn't hear it and process it the same way. So, this idea of words to be heard, right? What are we saying that is landing or like flying right out of the room? The idea of communicating with ethics is so critically important. And I
yeah.
cannot say that enough. I've been a member of the Academy forever and certainly a member of CDR as a registered dietitian. And whether or not people are members of the Academy, we are all bound by that code of ethics. What we say is really important. And, I feel like I stalk sometimes. I don't. I mean, I will talk just personally offline to say, is
Yeah.
think about what you're doing, right? Because we are never the N of one. We are the N of the 70,000 registered
Mhm.
dietitians that are out there. So, that's our calling card. It is really important. Or what I would also say, and then I'll shut up, is this it really when people are communicating, are they communicating for attention or intention? Those are not one and the same thing. And I
Yeah.
think the fact that we are healthcare professionals, door number two is the door, communicating with intention.
Love that.
Kelly.
Absolutely love it. Well, I mean, it is a cornerstone, right, of how things come across on people's interpretation, on their perception, and certainly on their understanding. And so it's just such a critical piece. I'm curious, in your talk, are you talking mostly to the health professionals? Are you talking in general, like how we communicate with clients and people, or is it just kind of across the spectrum with,
It's across all is,
yeah.
whether if communicating with our family, right, about a topic
Hmm.
that might be a little bit dicey, but and also
Right.
talking about what is misinformation, what is disinformation, how important CT is, not a CT scan, critical thinking. CT scan is
Right.
critical thinking in the evaluation of what it is that we're putting out there. Yeah, that's for our credibility, but it's
Mhm.
also trying to set the stage to encourage the rapport and the trust and all of those things that are really important for
Yeah.
us to do. So we have somebody who might come back. It's like, I liked what that person had to say, right? Yes, that's engaging the neck up. It's not
Right.
just about the neck down, it's the rest of the body too.
Well, now, I mean, we're even going to have more challenges with, that misinformation piece with the AI models that are developing, and, who's overseeing a lot of that communication that's coming out into our field. And I know I've been involved in some of the back end AI development with some things, and that's always something that's a little dicey too, with the way that we're distributing information differently than we were just a very short time ago.
Well, it's here and that's not going away. And certainly it can be a wonderful tool to help us be more effective at what we do, but it's not fail proof, right? And so that
Right.
means looking at that information, making sure that we're using it appropriately. And I'm going to talk about that a little bit too, because hey, it's not just cut and
Right.
paste. That's not what we're doing here,
Exactly.
right? Because it's not perfect. I'm like, oh, that's not what I meant. Okay, we thought about that before you used it in a conversation.
Yeah. Well, I mean, now these kids, coming up in education, I mean, this is kind of where they're going to be. Hey, let me go write my research paper.
Well, you
It's
know what? Professors are on to
completely
this. Like, that's
different.
that's I mean, Roberta talks about
Thank
this all the
goodness.
time. She can spot it a mile away. So that might sound like the easy thing to do. And guess what? Oh, you don't pass the class. So
Right.
it is really important for people to understand this. That
Yeah.
sounded old and
I
cranky,
love
but
it.
hey, we all put in our
No,
sweat equity, right?
No.
We do. And that's the
yeah.
only way you learn is putting in the effort to learn, not just taking it from somebody else who did it.
Well, I think we need that mature perspective, that you have. It's not aging or, in any way outdated. I feel like it's extremely relevant to, younger people, to the type of mentorship that we need to provide as dietitians that have been in this field for a long time and can understand how to do it right, and the importance. I love the focus on ethics and just communication and being able to distribute the information, evidence based practice, right? So that we go back and let people know that this is how we're into the scientific advancement of nutrition. What do we know, not what are we guessing at? So that, I think that's really important.
And we need to humanize it too. And that means with emotions. And that means meeting people where they are. So, we're not here, read this PubMed article said no athlete ever. They're not going to do
Right.
that. We just have to do that in the background, but then it's going through this process. And how do we translate that in our communication to something that's digestible, to something that's comprehensible, and most importantly, something that will actually be put into play. Otherwise, let's not have the conversation.
Well, I want to ask you a quick question because I think this perspective would really be interesting. So, how do you think you've changed coming in from the time you were a young dietitian through all of these experiences that you've had in professional, collegiate, Olympic, all the people that you've interacted with? I mean, how has that shaped you to the person that you are now in this field? I mean, I'm so curious, when you came out, what was your scope like?
You
And
know
then
what?
now you have such a vast and different scope and
I
perception.
think for all of us, we're in this field and, we're helpers. We want to tell people everything that I know because, oh my God, that's you all need to know this as well. And that has really changed. And that we don't have to give people the whole menu. We could start with the soup or the dessert, not all of it. And so being able to develop those skills of being precise. So it's kind of here's the hook to have them coming back for more. I think that's really been the biggest thing because you can build on it, right? That's the beauty of social media. You can
Right.
only do a minute, not an hour. And so, okay. And so let's start with those little things to really not only to get people excited, but I think it lands better because otherwise
Right.
I can't do that. Oh my God, you're giving me all these things. It's like to choose an avoid list. Everything we like is on the avoid list. So that's it. We've lost them. That's probably the biggest thing. And I think the other thing is that our athletes, active people are visual learners, right? So if it's not just talking about it, it's showing it, it's hands on, hands in, it's the tasting it, it's all of it. Not just because you win them over. You do when you provide food, but it's also giving them survival skills or maybe a chance to taste something they never would have tasted before. And then I think to Kelly's point is just the fascinating aspect of we better always be learning. I mean,
Right.
this is it, is applying above and beyond, might know whether it's omega-3 or leucine or whatever it is that's broadening. And that is keeping up. We have to be able to keep up to keep on. Either or is that's absolutely essential.
Yeah. Awesome. Love it. All right, Kelly, give us a little sneak peek about what you're talking about. I mean, this is just so fascinating and just such a great connection to be making with our athletes and coaches and dietitians that are working in the space. So, tell us a little bit about what you're learning with omega 3s and eating disorders and mental health.
Yeah, I mean, as I said before, I think this is a really emerging area of research and interest for people kind of across the spectrum, but athletes as well too. Kind of the more we learn about how, especially in sport, can affect your mental health from really, really young ages all the way up through, especially elite athletes. And eating disorders, especially in sport, can be they can be sneaky, right? And they can transition from someone who's really just focused on trying to optimize their performance and pretty quickly slip into something that's a bit more pathological. So omega 3s, the research in eating disorders, it's pretty new. There's not a ton, we're going to be talking specifically about anorexia and bulimia. I'm going to mention, reds in within sport, but I think a lot gets talked about that, and we kind of want to focus on kind of the more severe cases that absolutely do happen in athletes.
Yeah.
And I'm going to look a little bit at the research. It's an emerging area, so we can't make any definitive claims, but we're going to look at some topics and look a little bit about comorbidities, things like anxiety and depression, and where omega 3s can kind of go along and may be beneficial there. But yeah, I mean, we're kind of in a space with omega 3s where it's new in that area, and so we can't make any
Right.
declarations that we've found a treatment that absolutely works, but staying on top of the research is important.
Yeah. So, I mean, where is the research focus? I mean, are they kind of what is it with the connection between the omega 3s and some of these mental health conditions that we're looking at?
So a lot, when it comes to eating disorders specifically, there's sort of two buckets of research. There's treatment, right? Can omega 3s be used as an adjunct treatment along with eating disorders to help with recovery?
Hmm.
And then there's prevention. Do some of the comorbidities, things like anxiety and depression, will they be beneficial? Will omega 3s be beneficial to help preventing individuals who maybe show some signs of that anxiety and depression from getting moving towards things like eating disorders? Can we
Hmm.
help alleviate some of those comorbid conditions, and help with treatment of those comorbid conditions, to help prevent athletes from experiencing more severe conditions?
Interesting. Fascinating. Well, so I know you work with Omega Quant. So can you tell us a little bit about kind of the testing process that you guys use there and what's available for athletes as far as learning more about that?
Sure, yeah. So, as I mentioned, we're a clinical laboratory, so that's what we do is we test blood. That's our primary job. We test blood and we educate people. Those are our we see as our two
Yeah.
biggest jobs. And so our kind of the test many sports dietitians will have heard of. If you haven't, it's called the omega 3 index. It is a measure of two omega 3 fatty acids in the red blood cell membrane, and it is a really good biomarker for omega 3 intakes over time, right? We compare it a lot to a plasma based test. So, testing something in plasma versus red blood cell, it's a lot like taking a fasting glucose versus taking an A1C, where, an A1C gives you a much better picture of your blood sugar regulation over time. So does the omega 3 index. It gives a 3 month ish window into how much omega 3s someone's taking in. And it correlates
Okay.
really, really well with tissue omega 3 status, which is really, really important, right? We don't care as much about a blood level if it doesn't correlate to tissue levels, because that's where omega 3s are actually acting, is on tissue in our cardiovascular system, in our brains, muscles, all throughout our bodies. So the omega 3 index, we can do, it's an at home test as far as specimen collection, sample collection. It's a finger prick, 1 drop of blood on a sample card. You stick it back in the mail and send it off to our lab. We do the analysis and we email you the results. We work with everybody from individual healthcare practitioners, individual consumers. We work with research institutions. We work with a lot of sports dietitians testing their teams. And it's a really good measure for a lot of things. I think in sports nutrition and nutrition in general, sometimes some of the things we're doing, especially on the preventative health side, we need kind of the carrot to motivate people to make those changes. And so something like eating more fish, which, we always love the food first approach if we can, but something like eating more fish or taking a fish oil supplement. Some people, a thing I've heard a lot in my career when I was working with the military is like, I don't feel any different. And, some people will say they feel different, especially if they have like joint pain, things like that. Some people will say, listen, I'm taking this fish oil, I'm feeling different. And having a lab value that is, correlated to a lot of health, benefits, performance benefits as well, is really, really helpful to give to patients, to athletes, to say, hey, look, you are actually improving something on kind of a biochemical
Mm-hmm.
level.
Mm-hmm.
It is actually doing something for you. And the omega-3 index, having higher EPA and DHA levels is correlated to all sorts of health areas, but probably the most robust body of evidence is cardiovascular disease risk. We see lower rates of cardiovascular events, sudden cardiovascular events, and cardiovascular death with people who have higher levels of omega-3 index. But on
Mm-hmm.
the sports side, higher omega-3s is also shown to improve muscle recovery, heart rate recovery, heart rate variability, and then again, some of those it had potent anti-inflammatory action as well too. So all things that athletes really need to be concerned with. And again, that mental health side is kind of emerging research there as well.
Yeah. Well, I know we've got some, good science around concussions and
Oh
that
yeah,
kind of that place
absolutely.
too. And then I think it's important to say too, I mean, these are essential fats, right? So these are
Yep.
things that we really need to get through our diet. And maybe when people aren't feeling the difference between doing this or that their essential fat intake has been low, and that, bringing that back up into normal level is going to have kind of an immediate like, oh, okay, I feel better,
Yeah. Yeah.
to some
Yeah,
degree.
and definitely some people do notice a difference,
Mm-hmm.
especially those with like kind of chronic joint pain. And in
Mm-hmm.
sports, I mean, geez, that's a lot of athletes, right? Experiencing
Right.
experiencing, chronic pain. That can be a big like red flag. Things like dry
Mm-hmm.
eyes, again, another one where people don't really think about that being a nutritional issue. But dry eye absolutely can be at least helped with correcting your omega-3 status.
Interesting. I did not know
Yeah.
that. So
Yeah.
yeah. My grandmother actually suffered from that. I wish I'd known back in the day.
Yeah,
Who
it's one of
knew?
those, and no one thinks of that, and I
Yeah.
wouldn't have thought of it either, but yeah, it
Mm-hmm.
absolutely, dry eye is one of those
It's
things that you're like, oh my
Sjogren's
gosh, my
syndrome.
eyes feel better.
Sjogren's. I think it's called
Yeah.
Sjogren's
Yeah.
Hmm.
syndrome is what it can lead to.
Yep.
But yeah, okay, well, that's fascinating because I know there weren't any really good treatments at that point in time
Yeah.
for it. So yeah, great. Well, oh my gosh, so excited! Can't wait to see everybody next week. Absolutely love the Sports Nutrition Symposium that my sports dietitian puts together for all of the people working with and around athletes. We always have a great lineup of speakers. We're thrilled to have you both. So thank you for a little bit of your time this morning and being able to share your topics with some of our listeners. Again, we are speaking with Kelly Patterson. She's going to be presenting on omega-3s and eating disorders on Monday, February 23rd at 1:30 p.m. And then we have Leslie Bonsi presenting on communication with conviction, words to be heard. And Leslie has been around for just a really long time. We're thrilled to have her longevity in sport to present with us on Tuesday, February 24th at 1:30. So thank you both for coming on live with my sports dietitian this morning. We've just enjoyed the conversation and can't wait to learn more.
Thank you for having us.
Absolutely.
Thank you so much.
And for now, this is the Huddle talking about all things sports nutrition, and we will catch you on our next episode. Thank you so much. Have a great day.